Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 25 practice NCLEX questions. Without the way, let's get started.
A nurse is teaching the family of an 8-year-old boy with acute lymphocytic leukemia about appropriate activities. Which of the following activities should the nurse recommend? 1. Homeschooling. 2. Restriction from participating in athletic activities. 3. Avoiding trips to the shopping mall. 4. Being treated as normal as much as possible. The correct answer is 4. Any child with a chronic illness should be treated as normally as possible. Unless the child has severe bone marrow depression, he should be allowed to go to school with others and can go to the mall. If the child is in remission, athletic activities are allowed. After teaching the parents of a child newly diagnosed with leukemia about the disease, which of the following descriptions given by the mother best indicates that she understands the nature of leukemia? 1. The disease is an infection resulting in increased white blood cell production. 2. The disease is a type of cancer characterized by an increase in immature white blood cells. 3. The disease is an inflammation associated with enlargement of the lymph nodes. 4. The disease is an allergic disorder involving increased circulating antibodies in the blood. The correct answer is 2. Leukemia is a neoplastic or cancerous disorder of blood-forming tissues that is characterized by a proliferation of immature white blood cells. Leukemia is not an infection, inflammation, or allergic disorder. Which of the following findings would suggest pneumothorax in a trauma victim? 1. Pronounced crackles. 2. Inspiratory wheezing. 3. Dullness on percussion. 4. Absent breath sounds. The correct answer is 4. Pneumothorax means that the lung has collapsed and is not functioning. The nurse will hear no sounds of air movement on auscultation. Movement of air through mucus produces crackles. Wheezing occurs when airways become obstructed. Dullness on percussion indicates increased density of lung tissue, usually caused by accumulation of fluid. A client has a chest tube attached to a water seal drainage system, and the nurse notes that the fluid in the chest tube and in the water seal column has stopped fluctuating. The nurse should determine that 1. The lung has fully expanded. 2. The lung has collapsed. 3. The chest tube is in the pleural space. 4. The mediastinal space has decreased. The correct answer is 1. Cessation of fluid fluctuation in the tubing can mean one of several things. The lung has fully expanded and negative intrapleural pressure has been reestablished. The chest tube is occluded, or the chest tube is not in the pleural space. Fluid fluctuation occurs because, during inspiration, intrapleural pressure exceeds the negative pressure generated in the water seal system. Therefore, drainage moves toward the client. During expiration, the pleural pressure exceeds that generated in the water seal system, and fluid moves away from the client. When the lung is collapsed or the chest tube is in the pleural space, fluid fluctuation is likely to be noted. The chest tube is not inserted in the mediastinal space. The nurse in the perioperative area is preparing a client for surgery and notices that the client looks sad. The client says, "I'm scared of having cancer. It's so horrible and I brought on myself. I should have quit smoking years ago." What would be the nurse's best response to the client? 1. It's okay to be scared. What is it about cancer that you're afraid of? 2. It's normal to be scared. I would be 2. We'll help you through it. 3. Don't be so hard on yourself. You don't know if your smoking caused a cancer. 4. Do you feel guilty because you smoked? The correct answer is 1. Acknowledging the basic feeling the client expresses fear and asking an open-ended question allows the client to explain any fears. The other options dismiss the client's feelings and may give false reassurance or label the client's feelings. The client should be encouraged to explore feelings about a cancer diagnosis. The nurse is planning care for a group of clients who are chronically mentally ill. Which of the following strategies is likely to be the least beneficial for the client population? 1. Teaching independent living skills. 2. Assisting clients with living arrangements. 3. Helping clients in insight-oriented therapy. 4. Linking clients with community resources. The correct answer is 3. Insight-oriented therapy is less beneficial for this client population. The nurse's role in a psychosocial rehabilitation program involves teaching the client to live independently by using interpersonal skills and community resources. A client with chronic undifferentiated schizophrenia reports doing very little all day except sleeping and eating. The nurse should 1. Have 3 meals per day brought in to increase the amount of time the client spends out of bed. 2. Ask a relative to call the client at least 10 times a day to decrease the sleeping. 3. Help the client set up a daily activity schedule to include setting a wake-up alarm. 4. Arrange for the client to move to a group home with structured activities. The correct answer is 3. The client with CUS needs more structure every day to improve functioning. Therefore, helping the client to set up a daily activity schedule is most appropriate. However, a group home is not necessary. The client is already eating. Having meals brought in would increase the client's dependence, not his activity level. Asking a relative to call the client 10 times per day is unrealistic given the typical daily responsibilities of a healthy relative. A 77-year-old client is brought to the emergency department by her son. The client has severe headache and lack of sleep because I'm so worried about everything. Her son says that she has heart failure and chronic schizophrenia. In addition to all of her heart medicines, she is on aripiprazole, which was increased to 30 milligrams by her family doctor 3 days ago. In addition to documenting all the client's medications and exact dosages, the nurse should particularly investigate which of the following? Select all that apply. 1. The qualifications of the client's primary care provider. 2. The client's symptoms of schizophrenia. 3. The dose of aripiprazole. 4. The client's symptoms of heart failure. 5. The client's relationship with her son. The correct answers are 2, 3, 4. The client's symptoms are likely to be adverse effects of aripiprazole, especially at the reported dose. The normal adult dose is 5 to 10 milligrams. The elderly client commonly needs a lower dose compared with other adults. The anxiety and sleep disturbance could be symptoms of schizophrenia or medication adverse effects. A holistic approach would include assessing the client's heart failure. Questioning the qualifications of the family doctor is unproductive. There are no indications of problems in the client's relationship with her son. A client has just had a cesarean section for a prolapsed cord. In reviewing the client's history, which of the following factors places a client at risk for cord prolapse? Select all that apply. 1 - 2 station. 2. Low birth weight infant. 3. Rupture of membranes. 4. Breech presentation. 5. Prior abortion. 6. Low-lying placenta. The correct answers are 1, 2, 3, and 4. Having the fetus at a negative station places the client at risk for a cord prolapse. With a negative station, there is room between the fetal head and the maternal pelvis for the cord to slip through. A small infant is more mobile within the uterus, and the cord can rest between the fetus and the inside of the uterus or below the fetal head. With a large infant, the head is usually in a vertex presentation and includes the lower portion of the uterus, preventing the cord from slipping by. When membranes rupture, the cord can be swept through with the amniotic fluid. In a breech presentation, the fetal head is in the fundus and smaller portions of the fetus settle into the lower portion of the uterus, allowing the cord to lie beside the fetus. Prior abortion and a low-lying placenta have no correlation to cord prolapse. The primary healthcare provider prescribes 1,000 milliliters of Ringer's lactate intravenously over an 8-hour period for a 29-year-old prima gravida client at 16 weeks gestation with hyperemesis. The drip factor is 12 drops per milliliter. The nurse should administer the IV infusion at how many drops per minute? Blank drops per minute. The correct answer is 25 drops per minute. The formula is set up as 12 drops over 1 milliliter times 1,000 milliliter over 8 hours times 1 hour over 60 minutes. You multiply everything and you get 12,000 over 480. You divide 12,000 by 480 and you get 25 drops per minute. A 10-year-old with leukemia is taking immunosuppressive drugs. To maintain health, the nurse should instruct the child and parents to 1. Continue with immunizations. 2. Not receive any live attenuated vaccines. 3. Receive vitamin and mineral supplements. 4. Stay away from peers. The correct answer is 2. Children who are immunosuppressed should not receive any live attenuated vaccines. Clients who are immunosuppressed and are given live attenuated vaccines, such as measles, mumps, rubella, and oral polio vaccine, can develop severe forms of diseases for which they're being immunized, which can result in death. Inactivated vaccines may be given if necessary, but the client is not able to adequately produce needed antibodies, and it is recommended that immunizations be delayed for 3 months after the immunosuppressive drugs have been discontinued. Vitamin and mineral supplements are not normally given in conjunction with immunosuppressive drugs. When the client is immunosuppressed, the client should avoid only persons who have an infection. A 12-year-old with leukemia is receiving cyclophosphamide. The nurse should assess for the adverse effect of 1. Photosensitivity, 2. Ataxia, 3. Cystitis, 4. Cardiac arrhythmias. The correct answer is 3. Cystitis is a potential adverse effect of cyclophosphamide. The client should be monitored for pain on urination. Photosensitivity, ataxia, and cardiac arrhythmias are not adverse effects associated with cyclophosphamide. A client who is recovering from chest trauma is to be discharged home with a chest tube drainage system intact. The nurse should instruct the client to call the physician for which of the following? 1. Respiratory rate greater than 16 breaths per minute. 2. Continuous bubbling in the water-sealed chamber. 3. Fluid in the chest tube. 4. Fluctuation of fluid in the water-sealed chamber. The correct answer is 2. Continuous bubbling in the water-sealed chamber indicates a leak in the system, and the client needs to be instructed to notify the physician if continuous bubbling occurs. A respiratory rate of more than 16 breaths per minute may not be unusual and does not necessarily mean that the client should notify the physician. Fluid in the chest tube is expected, as is fluctuation of the fluid in the water-sealed chamber. When caring for a client with a chest tube and water-sealed drainage system, the nurse should 1. Verify that the air vent on the water-sealed drainage system is capped when the suction is off. 2. Strip the chest drainage tubes at least every 4 hours if excessive bleeding occurs. 3. Ensure that the chest tube is clamped when moving the client out of the bed. 4. Make sure that the drainage apparatus is always below the client's chest level. The correct answer is 4. The drainage apparatus is always kept below the client's chest level to prevent backflow of fluid into the pleural space. The air vent must always be open in the closed chest drainage system to allow air from the client to escape. Stripping a chest tube causes excessive negative intrapleural pressure and is not recommended. Clamping a chest tube when moving a client is not recommended. A female client diagnosed with lung cancer is to have a left lower lobectomy. Which of the following increases a client's risk of developing postoperative pulmonary complications? 1. Height is 5 feet 7 inches and weight is 110 pounds. 2. The client tends to keep her real feelings to herself. 3. She ambulates and can climb 1 flight of stairs without dyspnea. 4. The client is 58 years of age. The correct answer is 1. Risk factors for postoperative pulmonary complications include malnourishment, which is indicated by this client's height and weight. It is thought that emotion responses can affect overall health. However, not verbalizing one's feelings is not a contributing factor in postoperative pulmonary complications. The client's current activity level and age do not place her at increased risk for complications. When working with clients who are experiencing chronic mental illnesses, which of the following should the nurse expect to be generally the least necessary for this client population? 1. Community-based treatment programs. 2. Psychosocial rehabilitation. 3. Employment opportunities. 4. Custodial care in long-term hospitals. The correct answer is 4. During necessary periods of hospitalization, active treatment, rather than custodial care is needed. Among the more common needs of the chronically mentally ill are community-based treatment programs, psychosocial rehabilitation programs, and employment opportunities. An outpatient client who has been receiving haloperidol for 2 days develops muscular rigidity, altered consciousness, a temperature of 103 degrees Fahrenheit, and trouble breathing on day 3. The nurse interprets these findings as indicating which of the following? 1. Neuroleptic malignant syndrome. 2. Tardive dyskinesia. 3. Extrapyramidal adverse effects. 4. Drug-induced Parkinsonism. The correct answer is 1. The client is exhibiting hallmark signs and symptoms of life-threatening neuroleptic malignant syndrome induced by the haloperidol. Tardive dyskinesia usually occurs later in treatment, typically months to years later. Extrapyramidal adverse effects and drug-induced Parkinsonism, although common, are not life-threatening. A client diagnosed with schizophrenia is brought to the hospital from a group home where he became agitated, threw a chair at another client, and has been refusing medication for 8 weeks. The client exhibits a flat affect, is not caring for his hygiene, and has become increasingly withdrawn and asocial. The primary healthcare provider prescribes treatment with risperidone to improve the client's negative and positive symptoms of schizophrenia. When evaluating the drug's effectiveness on the client's negative symptoms, the nurse should expect improvement in which of the following? 1. Apathy, affect, social isolation. 2. Agitation, delusions, hallucinations. 3. Hostility, ideas of reference, tangential speech. 4. Aggression, bizarre behavior, illusions. The correct answer is 1. When determining the effectiveness of risperidone, the nurse would expect improvement in the client's negative symptoms of apathy, flat affect, and social withdrawal. Delusions, hallucinations, illusions, and ideas of reference are positive symptoms of schizophrenia. Agitation, hostility, and aggression are the result of the positive symptoms. A laboring client at -2 station has a spontaneous rupture of the membranes, and a cord immediately protrudes from the vagina. The nurse should first: 1. Place gentle pressure upward on the fetal head. 2. Place the cord back into the vagina to keep it moist. 3. Begin oxygen by face mask at 8 to 10 liters per minute. 4. Turn the client on her left side. The correct answer is 1. The nurse should place a hand on the fetal head and provide gentle upward pressure to relieve compression on the cord. Doing so allows oxygen to continue flowing to the fetus. The cord should never be placed back into the vagina because doing so may further compress it. Administering oxygen is an appropriate measure but will not serve a useful purpose until the pressure is relieved on the cord, enabling perfusion to the infant. Turning the client to her left side facilitates better perfusion to the mother, but until the compression on the cord is relieved, the increased oxygen will not serve its purpose. Placing the client in a Trendelenburg or knee chest position would be position changes to increase perfusion to the infant by relieving cord compression. A multigravida client is admitted at 16 weeks gestation with a diagnosis of hyperemesis gravidarum. The nurse should explain to the client that hyperemesis gravidarum is thought to be related to high levels of which of the following hormones? 1. Progesterone. 2. Estrogen. 3. Somatotropin. 4. Aldosterone. The correct answer is 2. Although the cause of hyperemesis is still unclear, it is thought to be related to high estrogen and human chorionic gonadotropin levels or to trophoblastic activity or gonadotropin production. Hyperemesis is also associated with infectious conditions, such as hepatitis or encephalitis, intestinal obstruction, peptic ulcer, and hydatidiform mole. Progesterone is a relaxant used during pregnancy and would not stimulate vomiting. Somatotropin is a growth hormone used in children. Aldosterone is a male hormone. A 12-year-old with leukemia will be taking vincristine. The nurse should encourage the child to eat what kind of diet? 1. High residue. 2. Low residue. 3. Low fat. 4. High calorie. The correct answer is 1. Vincristine may cause constipation, so the client should be encouraged to eat a high residue diet. The other diets do not help with constipation that can occur while receiving vincristine. A 15-year-old has been admitted to the hospital with a diagnosis of acute lymphocytic leukemia. Which of the following signs and symptoms require the most immediate nursing intervention? 1. Fatigue and anorexia. 2. Fever and petechiae. 3. Swollen neck lymph glands and lethargy. 4. Enlarged liver and spleen. The correct answer is 2. Fever and petechiae associated with acute lymphocytic leukemia indicate a suppression of normal white blood cells and thrombocytes by the bone marrow and put the client at risk for other infections and bleeding. The nurse should initiate infection control and safety precautions to reduce these risks. Fatigue is a common symptom of leukemia due to red blood cell suppression. Although the client should be told about the need for rest and meal planning, such teaching is not the priority intervention. Swollen glands and lethargy may be uncomfortable, but they do not require immediate intervention. An enlarged liver and spleen do require safety precautions that prevent injury to the abdomen. However, these precautions are not the priority. A client with rib fractures and a pneumothorax has a chest tube inserted that is connected to a water-sealed chest tube drainage system. The nurse notes that the fluid in the water-seal column is fluctuating with each breath that the client takes. What is the significance of this fluctuation? 1. An obstruction is present in the chest tube. 2. The client is developing subcutaneous emphysema. 3. The chest tube system is functioning properly. 4. There's a leak in the chest tube system. The correct answer is 3. Fluctuation of fluid in the water seal column with respirations indicates that the system is functioning properly. If an obstruction were present in the chest tube, fluid fluctuation would be absent. Subcutaneous emphysema occurs when air pockets can be palpated beneath the client's skin around the chest tube insertion site. A leak in the system is indicated when continuous bubbling occurs in the water seal column. The nurse has assisted the physician at the bedside with insertion of a left subclavian, triple lumen catheter in a client admitted with lung cancer. Suddenly, the client becomes restless and tachypneic. The nurse should 1. Assess breath sounds. 2. Remove the catheter. 3. Insert a peripheral IV. 4. Reposition the client. The correct answer is 1. The nurse should first assess for bilateral breath sounds since a complication of central line insertion is a pneumothorax, which would cause an increase in respiratory rate and drop in oxygen, causing irritability. The nurse should also assess blood pressure and heart rate for the complication of bleeding. A chest X-ray will be performed to determine correct placement and complications. A central line was most likely placed because peripheral IV access was not available or adequate for the client. Repositioning may be considered after assessments are done. Which of the following rehabilitative measures should the nurse teach the client who has undergone chest surgery to prevent shoulder ankylosis? 1. Turn from side to side. 2. Raise and lower the head. 3. Raise the arm on the affected side over the head. 4. Flex and extend the elbow on the affected side. The correct answer is 3. A client who has undergone chest surgery should be taught to raise the arm on the affected side over the head to help prevent shoulder ankylosis. This exercise helps restore normal shoulder movement, prevents stiffening of the shoulder joint, and improves muscle tone and power. Turning from side to side, raising and lowering the head, and flexing and extending the elbow on the affected side do not exercise the shoulder joint.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.